When you're feeling a little sick, do you turn to Dr. Google for help? Well, you just might be getting bad advice. I'm Dr. Greg Cason, and this is Off the Couch. Now, I'm as guilty as the next person. I will go to WebMD and I'll do their symptom checker and I'll see what kinds of illnesses I could possibly have, and it'll always overwhelm me with all kinds of different advice. And then I'll maybe introduce a different symptom just to see if I tweaked it a different way, if I got a different result, and then I walk away completely overwhelmed. So for me, I finally just stopped doing it because I didn't think it gave me all that good advice. But these are one of the most popular things that people do on the internet today. But according to a study done at Edith Cowan University down in Australia and published in the Medical Journal of Australia, these studies are only good about a third of the time. Now, it's not the studies that are good about a third of the time. It's actually the symptom checkers that are good about a third of the time. Nonetheless, the study actually analyzed 36 symptom checkers, these web-based symptom checkers like the one on WebMD that I turn to so frequently, and found that the first result, or the correct diagnosis, only came up 36% of the time. And the correct diagnosis only came up in the top three 52% of the time. The research also found that advice provided on when and where to seek health care was accurate only about 49% of the time. So it's starting to look a little bleak. Just because you think you have a certain symptom and you turn to a symptom checker online, you may not be getting an accurate result. And you may actually not seek health care thinking you have something minor because the symptom checker pointed you in that direction, or you may be presenting at an emergency department thinking you have something major when it's actually something very minor, and then you just find yourself with a big emergency department bill and a whole lot of time wasted. Now, it's been estimated that there are 70,000 health-related searches on Google every minute. That's 70,000 people looking for health-related information every minute on Google. The problem is a little something that I talked about years ago in a video called CYBERCHONDRIA. And CYBERCHONDRIA is really this belief that you have a disease that you've looked up online. Another term that's used that I don't think is quite as sexy is COMPUCHONDRIA. No, it doesn't work. But CYBERCHONDRIA really kind of doesn't. We're all cyberchondriacs at some time. And if it sounds familiar to hypochondria, that's because it is. It's basically just hypochondria that's emitted from something that you looked up online. And when we look up these symptoms, we actually feel like we have them. You know, almost every medical student knows this when they start medical school and they start looking up diseases and they start thinking they have the diseases that they're looking up. And psychology students as well, when they start looking up mental illnesses and they wonder if they have the mental illnesses, or they start diagnosing everyone around them in their life. And you know what? Usually they're wrong. But the problem is that's just it. We overemphasize things in the beginning because we're afraid or because we don't have enough knowledge to know that we're wrong. If you'll look at my video on coronavirus conspiracy theories, you'll actually see something on the Dunning-Kruger effect that kind of talks about that dynamic as well. But I digress. Now, people who lack healthcare information may actually see these sites as somewhat of a godsend because it actually tells them some stuff that they can get right away, and they don't have to call their doctor or try to navigate the healthcare system. But when to go see a doctor, these sites may actually mislead people as well. They found that people who were in emergency situations only got correct advice about 60% of the time, and people who were not in emergency situations only got correct advice about 30 to 40% of the time. So it seems that these sites can really mislead people. So what to do? Well, it seems like if you have some kind of medical issue, it is best to try to go see your medical provider. you can use the symptom checkers and the information that you get online as somewhat of a double check or somewhat of a place to get more information. I think sometimes when we spend time with our doctor in the doctor's office, we get a diagnosis, they say a few words to us and then leave, and we really have no idea what just happened or really don't think we had an adequate interaction. So sometimes we can take those few words and go home and maybe look something up and gather a lot more information. And maybe that can help us to begin to have more of a dialogue with our provider. I also don't think it's a bad idea, perhaps, to even look up something and go into your doctor with a few questions. It's always good to go in with a written list of questions to ask your doctor and to really try to partner with your doctor about what's going on. But one thing I found in the medical or the modern medical system is that some doctors will kind of do what you ask. So it's best to kind of go in there and see your doctor as more of a partner and not try to tell them what to do, because sometimes if you put yourself in the driver's seat, you could be driving down the wrong road. Instead, it's good to just really seek advice and assistance from your medical care provider. But until then, we'll always have Dr. Google. I just wouldn't put a lot of weight into Dr. Google's opinion. I'm Dr. Greg Cason, and this is Off the Couch.